So one of my curiosities with you is you seem to have chosen like some of the hardest things to go after. I mean, we're talking about concussions, brain injuries, POTS, balance disorders, peripheral neuropathy, like all of the hard stuff. Um, what led you down that lane?
I never really thought about that actually. I think I think it's just been a bit of a serendipitous journey for me. I think being a patient first, and then being a doctor second, and then now being like an advocate and educator third has kind of paved the way for me for that. I've always been infatuated by the brain. I think
Yeah,
like it's so amazing to have a brain. I think it's so amazing to think about that the fact that you can change your brain, like thoughts can genuinely literally change
yeah,
your physiology. And when you get deep into like understanding like the true magnitude of like the placebo effect and why every study has like a double blind placebo controlled variable
yeah,
where people just believe something and they can literally change the concentrations of hormones and chemicals in their brain and body. Like I've always been infatuated with that.
yeah,
So for me it was really kind of a non-negotiable to not go down that path. Like I've always just been sucked that direction and like sucked into those kind of things. And so
yeah,
with that territory comes the harder things that you describe. But at the end of the day, I think there's also just an inherent drive for me to like want to know why. Like I've always been that kid who just asks way too many questions, and so that's
yeah.
translated well to me being an adult and having a profession that I have. So
Was
I don't
was
know if
there a
I chose
challenge?
that.
Was there a
Yeah.
challenge for you as a patient? You mentioned patient at the beginning of that.
Um, yeah, I don't know if I would say challenge, but I think it's always an opportunity to learn. I would say, like, growing up, like was always a multi-sport athlete
Yeah.
and a good one as well, and fortunate for that. But I also like worked really hard. But I
Injuries?
always had, yeah, injuries. Taking hits to the head, playing hockey and soccer.
Yeah,
So
yeah,
um, I think the other aspect to it as well was I was just kind of like had like some low grade brain fog or like my diet wasn't always the best. Like I ate like
yeah,
Cheetos and like
yeah. Me
pizza
too.
bagel
I was
bites coming home from hockey practice,
terrible.
like
Yep.
right. So like I didn't know, and I was just like,
Yeah,
this is how we do it. Raised on cereal and milk, and so when I started digging into those things and realizing I could just have a better brain and live better and be more functional, I was like, okay, why? Of course I'm going to want to do that.
yeah.
So kind of a journey of like self exploration and finding what works, what doesn't for me, and then
Experimenting kind of
yeah,
all the time.
totally. Yeah. And then,
Yeah,
and
yeah,
then how that translates to patients, right? So probably
yeah,
some similar things along the lines for you is just like seeing what works for you, what you
yeah,
struggle with, and you're like, I want to find a solution for myself, and lo and behold, you find it for other people too. So,
yeah.
you know,
Was it was so? What was your? What did you do undergrad? Was it was were you always kind of science geared, or were you thinking about other things?
yeah, that's interesting. If you would have asked me that like my first day of like my freshman year, I would have told you I was going to be like a pharmaceutical rep for Pfizer and like
Okay.
go selling drugs. So like
Yeah.
very different than what I ended up doing.
Dollar signs of some sort, or what were you thinking?
Kind of. My defensive partner that I played hockey with, his mom was a massive influence to me, and she's an amazing
Okay.
woman, and she still is, and she was a rep for Pfizer, and she's like,
Oh,
"This
okay.
is how I've been able to help people and do things," and I was like, paid for a computer, laptop, car, like it's a pretty good gig,
Yeah.
and I thought that's what medicine was because that's how I was growing up and what I
Yep.
was used
Yep.
to. So undergrad was formative for me because I, gained the freshman like 30, 35, came home my freshman year and people are like, what happened to you? Right. So I was like, oh, things change. But then on top of that as well, like I got into nutrition, I got into exercise more, I got into like lifestyle, got into like really challenging my thinking. My freshman roommate was really into like lucid dreaming and like kind of like metacognition and all this stuff where I was like,
Yeah.
what are you talking about? So, maybe to some camps a bit woo-foo, but it's all neuroscience, right? It's all brain
Yeah.
stuff. So, I was exercise phys at the U and did some research with a neurologist who was studying movement disorders for the last 2.5, 3 years of my college. So that just put me down the path of neuroscience,
Yep.
and then asking the question of like, well, what else is there? So just kind of fueled that fire of curiosity that has always been there, and so um, I don't know. It was just I think at that point that I realized I was like, okay, like I want to do something brain based, and didn't want to go get a PhD because I didn't know what the career was going to be after that. Was
Yep.
maybe going to go as an MD or PT, and then chiropractic came through and chose that because I had some influence and family there as well, and so just kind of serendipitous paths. Like I
Mm-hmm.
never thought that I would go down that path, but I'm so grateful that I have kind of thing.
Yep.
you know?
That's so cool. Was there a moment in Cairo school then when you, because you've kind of even it doesn't seem like you spent a lot of time doing a very traditional chiropractic approach. You seems like you shifted. I mean, I met you maybe what 6 7 years ago,
Yeah.
and I feel like you were already on this path. I mean,
Yeah.
some of the speaking and stuff you were doing at that point, you were so tuned into the neuro stuff.
Yeah. I was pretty heavy into it right away. Because for me, I just had a lot of questions I didn't have answers to. And
Yeah,
so I was like, well, I kept coming back to the neurology and the neuroscience and understanding that, I use this silly analogy with patients, but it kind of hits home. It's like, go try and have a conversation with a cadaver that has all the muscles, all the joints, all the tissues, all the organs, and I promise you, you're not going to get very far, right?
right.
And it's silly tongue in cheek, right? But
Yeah, yeah,
like the reason why is because you don't have an intact nervous system. And so
yeah,
for me, whatever modality you use, whatever approach you use, you have to understand the neurological consequences. And to me, that just opens up so many opportunities to make sense of why a technique works,
yeah.
why a therapy in this setting works. And so it really allows you to critically think through things, but then explain things that seem unexplainable, for the lack of a better term. And to
Yeah.
me, that has changed my paradigm on my own health, but then also with how I approach patients. And I'm sure you have some of the same approaches as well,
Same.
but you
I
have
mean,
experienced it.
Totally. I mean, I started out same as you, like athlete, very very tough competitor, and everything that I did,
Yeah,
hard hitting stuff. And I also rode crew in college, so like the craziest training that I've ever done as an athlete was as a rower. So,
of course.
pushed very hard, tested my body, learned a lot from that process for sure. Then shifted over into more music stuff right after college. So sort of testing in a different kind of way, but like sitting a lot more. I was also taking writing courses because I was thinking that's the direction I wanted to go with my degree that I was going to teach. So I was doing a lot of sitting, and I think that started leading to some of the back problems and practicing and sitting, and then
Hmm.
hauling gear in and out of places at 2 o'clock in the morning, like that, all that stuff. Not sleeping enough, having to get up and go to work.
Yeah,
So
of
a lot
course.
of lifestyle shifts that luckily I didn't fall prey too much to like the partying and drinking stuff, but still, like, you know, we had a ritual as a band sometimes to go home and eat like as much cereal as we could. I mean, that was like this, you just deplete yourself so hard, even, physically playing music at that
Sure.
hour,
Yeah.
nothing's open. So you go home and just eat crap anyway. So anyway, same with me. Like I had to switch gears and really think about what and some of the chronic back issues I was having. A lot of it was muscle spasms. So I kind of learned that I had very loose ligaments and that was sort of causing problems for me. And I was able to solve that eventually. But even with my training, once I went back to massage school and started learning manual therapy stuff, my initially I was the same as you. It's like, okay, well, you can really get in there and push around the body and do all these things, but there are certain times when that's actually not going to be the right thing for the person
Yeah.
who's having a muscle spasm, right? You don't want to use
Yeah.
a lot of force at that point. So then I started getting interested in the nervous system, and also because I felt like I struggled with some anxiety stuff. That was sort of, I could sort of had empathy for what was going on with a person's experience, and knowing that I could sort of do something more gentle and kind of have an influence over that nervous system. And that was where I started to kind of lead into like nervous system stuff, and then started working with newborns, which was like a whole other nervous system type thing, and
Yeah, it's so cool.
seeing what a fresh nervous system looks like when it sort of, lets go of whatever response it has going on. GI stuff would improve and all the stuff. So, and then, it was just one thing after another for me. I just kind of kept going down these paths and realizing it's kind of all about the nervous system and about energy. Like those,
Hmm.
those are the two things that I was always like, how can we work on bolstering both of these, these pieces?
Yeah, and I think once you go down that rabbit hole, then it's almost like there's a point of no return where you're like, okay, well, gosh, there's just so much to learn. And I think this is
So
the
much.
part. I
Yeah.
think this is the part that really trips me up sometimes. Is like we think we know so much about the brain and the nervous system, and we do know a lot, right? But we still can't explain consciousness, right? Like
Right.
if for those who are like listening or have listened to like the telepathy tapes, there's this new podcast that's come out
Yeah.
about kids who are nonverbal, kind of lack motor skills for speech and language, or they thought that they did, and all of a sudden these kids can like communicate on an iPad, and they're like, I can tell what my mom's thinking. And
Yeah.
now they have like double blind, placebo controlled studies coming out now, like single variant like studies where it's like, Jeremy, you're reading on an iPad and I'm sitting across the room not looking at you and I'm like, Jeremy, I know exactly what you drew. Like, okay, completely throw everything you know out
Yeah.
the window. Like
Yeah.
that's a trip. And they're 100% accurate. Like things you can't make up. And now it challenges our entire understanding of metacognition and understanding just how, quantum physics and like, how all of these energetic based things that we use every day, like a cell phone. My phone's not
Yeah.
connected to any wire or cord, but I still get messages and service.
Yeah.
It's the same process, and
Yeah.
we're a bit naive to think the brain doesn't do the same, and so it just continues to change. And I think that's also a part of it that's a bit addicting. Is like, gosh, I can never know everything, and like, but can
Right.
I? Right?
Well,
Like,
so
I'm gonna
what
try.
I find interesting about you, Erik, is that so considering this, that you have that sense of the intuitive part of people and about how humans interact and how that energetic play happens. But then you're also working with more neuroelectrical gear.
Yeah.
How where how do you figure out when that's like the when you want that input, I guess.
Yeah.
As a manual therapist who doesn't do any electrical stuff, although I honestly feel like there's a part of my work where I think I've told you this before, but I feel a little bit like, because we're both musicians, I think I use this metaphor with you, but I almost kind of feel like I play the body a little bit. you
Yeah.
know, in sort of subtle ways. You've gotten some body work from me, so like I go from very gentle to very deep, depending on where I feel like I can kind of have an impact. But those are my only tools, right? That's my only field that I sort of work within. But
Yeah.
you kind of cross over into the electrical, so I'm just curious where you make decisions on that kind of stuff.
Yeah, I think I've had great mentors who have used similar things, and I've just realized that there's value in that.
Yeah,
I forget the name of the book, but it's something along the lines of like the electric body or body electric. And I read
yeah,
this when I
yeah,
was in college, right?
yeah,
So it's about like limb regeneration and like the change in polarity of electrical
yeah,
currents when you see limbs like regrowing in amphibians and kind of
yeah,
how all of this stuff works. And it just kind of just really tipped me upside down a bit to be like, this is one insane, but two, like the body really is electric. And so
yeah,
for me, it is about frequencies. It's about intensities and wavelengths, and so it's not as simple to say, "Oh, I'm just going to shine a light on Jeremy's head, and oh, you're going to feel better, and it's going to take away your autoimmune condition." But in some capacity, the research is showing that sometimes there are frequencies and wavelengths that can actually facilitate these processes that we
yeah,
used to deem woo-foo, right? And so
yeah,
there's parts of the way that I practice where we use like diagnostics to like quantify things, not only for
yeah,
myself, but also
yeah,
they're great for report of findings.
yeah,
Right. So the goggles that we use, the video nystagmography is a nice piece. But well, even using like, high energy, non-thermal like lasers can be really helpful for just
yeah,
promoting healing and using those. And so I don't have all of the tools in our office for a reason.
yeah,
Like I think that there's still benefit to being hands-on and educating people and doing that. I think you can overdiagnostic, but overdiagnose with hardware too.
yeah,
But the things that we've used have been beneficial enough, and I've used enough of hardware out there to know what's good and not. So I've made that call. But outside of that, if somebody looked into our office and saw like what we do for therapy and rehab, you'd be like, oh, that's it? Like, I
pretty
think most people
simple.
think when I'm doing neuro rehab, they're like, oh, you're like prodding the brain with like a, some sort of like percussor tool or like going in through the nose and like triggering the frontal lobe in some way. But it's
Yeah,
not, right? Like, I come back to the analogy, and this is kind of really probably where you maybe know more than I do, but like when I think about like, having a child and motor milestones and the way kids develop, we don't base their milestones off of like, anything else but physical movement in the earliest stages.
mm-hmm.
And so movement to me, as Anat Benil would say, like movement really is the language of the brain. And so that movement component, like whatever capacity it is, however you approach that, is so powerful for driving brain development. And we
Yeah,
use that in our office. I know you use that in our office. I've
yeah,
experienced it firsthand.
yeah,
And so it's coming back to a lot of the fundamentals of neuroscience. And then if there are tools to facilitate that, I will choose them and use them if I think that they'll help the patient improve or increase their healing times.
yeah,
And at times, I think that they're great and amazing. Other times, I'm like, okay, like there's got to be something better out there. So that's when I come to people like you who know more than I do in some aspects. And I'm like, dude, what am I missing? Right.
Well, that's, I mean, that's the nice thing about having the collaboration is like
Yeah.
we do have these, we have these sort of areas that are blind spots for us, or they're just not interests enough, right? We just
Yeah.
haven't, for
Fair.
whatever reason, that hasn't clicked for us, and we haven't gone that direction. And I mean, I try to hold off from treating babies for a long time because I thought I've got enough. I was like doing physical movement training and postural reeducation and rehab stuff, and then I was doing a lot of manual therapy work with people and all the big joints and retraining stuff. But the baby stuff just taught me so much
Hmm.
about what the system is in its most basic form, and also so interesting to have an experience. And babies just they have no BS meter. Like they know
Yeah.
who you are right away, and it's kind of great. There's something about just working with because when I'm especially when I'm working with like an adult who I know is going through some challenging emotional stuff.
Yeah.
There's always certain barriers there where I have to really work on the rapport part of my time with them to make sure that they feel comfortable enough to like even give me more information and let down with me and all that stuff. Babies just like raw in a half hour, they're going to go through a range depending on how neutral and how present I can just be for them. So anyway, it's a kind of a fascinating thing to have these different tools, but I think you have to be a little bit I think you have a capacity the longer that you do this work, but also you don't want to try to put yourself into too many things either.
Yeah. Well, and that's for me. I think what neuroscience and neurology has done for me is it's really opened my eyes to everything. So, I would say my strengths are really in the neurological and neurology, like neuroscience space. But I have to know about diet. I have to know about nutrition. I have to know about sleep. I have to know about the musculoskeletal system. I have to know about, digestion and the autonomic function. Like,
Yeah.
because it's a yes and conversation. That
Yeah.
doesn't mean I'm going to treat all of those things in my clinic. I mean,
Right.
we
Yeah.
do a decent amount, but what's great about that is like I know enough to know that I don't know enough, and I
Hmm.
find the best people who do that, and then awesome, I can either refer them to that person, or I can send them and co-manage that case, or I can ask them questions. Like, I think some of the best parts about medicine and practice is like I get to connect with really smart people like you, and like befriend them and ask them questions, and then over
Yeah.
time we get to share the benefits of like each other's knowledge and information, and it challenges my thinking, and that's always something for me that I'm continuously pursuing is what do I think that I know? What do I think that I know that actually I maybe don't know? And then what do I not know that I don't even know that I don't know? So like when I have
Yeah. Yeah.
discussions with people, I'm like, holy cow, like that's brilliant. And now I go off this on this tangent and down the rabbit hole of figuring out what they're talking about. And it's a humbling, continuous experience. And I think that's what's addicting to me about medicine
Yeah.
is it's never going to be the same. I mean, if it is, we're losing that battle. And there's a reason we're no longer bloodletting and doing frontal lobotomies, right? Like
Yeah.
at one point, maybe that was a standard, but today, like I promise you, we're not doing that.
Yeah.
So it kind of flips the script. And I'm sure you go through phases of that too, where you're going to have
Yeah.
a topic or something, you're like, okay, I got this. And you go through, and then years later, you're like, oh gosh, I forgot about that, or I didn't know it. And, you kind of just go through those phases of learning and unlearning almost.
But I appreciate that about you. I mean, and this is one of the things like I, to be honest, I find that men in health fields in medicine oftentimes think they're supposed to know everything. And
Mm,
so they act like they know everything, which I want somebody that I'm going to work with or who I'm going to collaborate with to know exactly what they know and what they don't know. And
yeah.
if I introduce something new to them, they say, I don't know that, which I feel like you're so good at with that kind of stuff. And that's the person that I trust. You know what I mean?
Yeah.
That's how I'm gonna work with, because we will eventually figure out how our certain pieces, specific pieces are going to work together to solve a problem. So
Yeah. Well, I guess I've always just kind of felt like that, and I've met people who tell me how much they know, and then I kind of pick it apart, and I'm like, yeah, but you're just really good at putting on a facade. Like you actually didn't know that. You just kind of bullshitted your way through whatever that was, right?
yeah,
And so
yeah,
I'm like, that's fine. That might work in sales, but like in medicine, for me, it's this forever pursuit of the truth and of what we know. And I think that's what's beautiful is like there may be something that we mentioned today that may be wrong tomorrow. Like that's
hmm
okay. Like as long as one, we learn from that, and two, we don't continue to portray that information. And so you kind of just have to have this inherent humility. And if you
Yeah.
don't, then you will get caught with your pants down, for lack of a better term,
At
right?
some
And
point, it's going to happen.
it happens. And if it does, it's a learning opportunity. And if it doesn't, then hopefully you're staying ahead of the curve and you're challenging your thoughts. So, um, I think one thing for me as I continue to get on the journey is it is kind of like that Dunning-Kruger effect where you think you know so much when you get out, and all of a sudden you're like, you learn things and you're like, yeah, I didn't know this, don't know this. And then you're at times you get through and you know a lot of stuff. But the more you know, then the more questions you have and the more you challenge the thinking of the norm, right? And so
Yeah.
I think I'm kind of getting on that back end of the slope where it's like, gosh, how much do I know? And yeah, I may know more than, the average person in medicine, but like I don't really know if I do because I have so many exceptions to the rules now, or yeah, but this makes sense, but this also in this condition it doesn't, and it kind of puts you into a position where you're really just challenging all of your beliefs, and to me that's fun because you get to kind
Yeah.
of use this thing that we call the frontal lobe to innovate and be creative, and I think that's where a lot of really cool things can happen, but
It's also where you get led more, I think, and I come kind of the same
yeah,
way that I like my day to day to be creative in that respect too, but I love solving a problem, so
totally,
I think we've both ended up in fields where you know, we're not usually the first person that they come to see for a problem.
yeah,
Eventually it may be that that's the case if like we've already worked with a family member of theirs or friend of theirs or whatever. But most of the time it's like people who have been to like 10 doctors and they've tried a lot of different things and maybe they've had minimal success, but they're really not at the function level that they want to be. So they come work with people like us
mhm,
and then we're willing to sit there with our discomfort a little bit more, I think, and be like, I don't know exactly what this is, but but trying to figure out what's the safest route to try some things and see what might actually, what kind of response I get if I try this, and then the diagnostics that you do, I think, are super cool, and being able to sort of peer into the brain through the eyes and through that diagnostics. If you can explain a little bit of that, by the way, at some point today,
yeah,
that would
happy
be
to.
that'd be super cool.
So before I do that, I think there's just something to be said about when you do see some of the patients that we do see. I think they've been told so many times beforehand that people know exactly what is wrong with them or exactly what to do. And then
Hmm.
they get burned enough times, they're like, okay, I know that that's not the truth. So it's refreshing to them to actually get to a point where it's like, listen, here's what I think is going on. I can't promise you, I can't guarantee it, but I'm willing to
Yeah.
try
Yeah.
and be open and honest with you about let's experiment and let's see what we can actually fulfill, right? So anybody who knows exactly what to do at any time for any treatment plan whatsoever is lying and run the opposite way, right? Like
Yeah.
you can have conviction and you should be like honest and feel as though you should be intentional with what you're doing, but there's no exact playbook. I mean, you're dealing with a 20 to 40-year-old million brain stuck in the 21st century. Like things shift and change and
Yeah.
perceptions matter, and you and I can have the exact same treatment plan, but if that patient likes you more than they
Yeah.
like me, they're going to get better with you. Like
Yeah.
that's the reality. So,
Yeah.
um, to your question about the diagnostics we do, so what Jeremy's referring to is we use these goggles. They're called video nystagmography (VNG) or video oculography, so VOOG. There's kind of simultaneous or interchangeable terms, and they're goggles that you essentially put on the face. So they cover your eyes and they have
They look
cameras
almost like a
inside of them.
VR headset type thing.
Exactly, like an Oculus headset. But they've been using these clinically for decades, and a lot of EENT offices will use them. So
Okay.
mostly looking at like dizziness, or they'll do calorics, things like that to try and check out inputs and outputs. And so kind of the analogy that I would equate to is the inputs need to match the outputs, or the outputs need to match the inputs. So if I go and I check a reflex, I should see that there's a response to that reflex that I would expect to see. If it's too high or too low, then I would say, hey, something's going on. Kind of the same thing if I go check a pulse or check something else. Like if I look at shine a light in the eye, I should see a reflexive movement of the pupil, and the pupil should get a little bit smaller.
Yeah.
The same thing is true for when we're testing specifically for like concussions, migraine, and even like a lot of like neurodegenerative disorders. I can see these things with neurodevelopmental issues as well. And what we essentially do is we do a standardized set of tests with these goggles on. So I know what the input is because that's standardized and it's on the TV or video camera.
Hmm.
And then the output is essentially what the brain responds and gives me. So for some tests, put people in the dark and they're not looking at anything. I kind of get to see the background of like how the brain is sitting and what's going on, and this is where I can find,
Yeah.
drifting of the eyes, do the pupils actually dilate, what's actually going on. Other tests are like looking at simple, basic things that we all take for granted until we lose it. And so this is really prominent with concussion patients is,
Yeah.
can you keep your eyes just parked on the target that's not moving? A lot of people really struggle with that.
Yeah.
And it seems like a simple task, but it's actually quite complex. There's a lot of
What's the
neuroscience
difference
behind
if you could explain between somebody who has a concussion and someone who should be in a little bit more normal vision or more normal tracking with their eyes?
Yeah. So I'll give you a caveat with it. What I'm really looking at is I'm looking at the software, not the hardware. So
Okay.
what I'm looking at like visual stability or visual focus is,
Yeah.
can the brain, one, peripherally locate a target in space, and can the brain
Right.
keep the eyes parked on that target, right? Can you
Okay.
look at my thumb?
Yeah.
Can you keep it focused and not like drift off or forget what you were doing kind of thing? There's a lot of circuits that are involved
Yeah.
with that.
Yeah.
The hardware component is if your vision's blurry, like, as an optometrist,
Right.
that'd be great set for them to go see. And is it the cornea? Is it the lens? Whatever, right? So I'm really looking at the software. If there's hardware issues with the eyeball itself, that's out of my scope and something I
Yep.
can't touch anyways.
Yep.
But most people should be able to fix their eyes on a target. The research that I'm aware of is that you spend pretty much 80% of your waking day fixated on a target. Now that doesn't mean you're looking at the only same target. Even when I'm talking, my eyes are, shifting back and forth, left and right. Well, that's an outcome of the frontal lobe. As I process information and kind of dig into my treasure troves, the brain reflexively will kick the eyes around. And so your brain and vision and eye movements are intimately tied together. And over half, and it depends on the literature you're looking at, something like 50 to 70% of the brain is involved in some aspect of vision,
Yeah.
in some way. And so you've got a lot of real estate for vision. And that's why we're looking at these diagnostic tools for diagnosing, concussions, TBIs, brain injuries, developmental issues, neurodegenerative conditions, things like, even just like dyslexia and ADHD. You can kind of see some patterns that
Yeah.
are, against the norm of the expected person. You can kind of see those. And so, like basic things, like I said, that we take for granted, visual fixation, just even tracking a target in space. Depth perception, so convergence and divergence,
Okay.
even like fixating your eyes and looking at a specific target. There's a lot of eye movements that we make that you shouldn't have to think about. But when the brain gets rattled and the cage is shaken, right, with a concussion or a TBI, it's kind of like pouring water on my laptop. I can't tell you exactly what systems are going to go down.
Right.
So we have to test them, right? We have to look at them. We have to evaluate them. And so as great as diagnostic imaging is for MRIs and CTs and even get to the higher Tesla-powered MRIs, they're still quite poor at diagnosing a concussion or brain injury
Yeah.
because they're looking at the hardware, they're looking at structure, which is appropriate for that setting. They're great at finding tumors and brain bleeds and venous malformations, right? But if
Yeah.
you come back with a clean MRI, it doesn't mean that your function is appropriate. So the analogy I give patients is like, listen, you can go look at all the photos of a car. You can go look at the physical car. You can see what's under the hood and look at inside the interior, but you have no idea how that car functions.
Yeah.
It's the same thing for the brain, right? An MRI or CT is looking at the car, looking at the photos and seeing the car physical in person. But the moment you start testing the functionality, right? Do the inputs match the outputs? If I push on the brake, does the brake work? If I put it into drive, does the car actually drive? I need to see those inputs and outputs, and that's really why these diagnostics are really important for me. And that's why a bedside examination is like
Yeah.
the fundamental aspect of understanding the brain and nervous system, is because I have to check those things. So the diagnostics are helpful for me because I can record them, I can quantify, I can have it say, here's Jeremy's brain at this point in time on this
Yeah.
day.
Yeah.
And if we do therapy, rehab, and train and change the brain, hopefully over time we can change those measures and outcomes and have objectable, quantifiable changes in the meantime of simultaneously hoping getting some symptomatic relief and improvement in function.
Right.
That's the whole goal for that.
Right. And so your combination is the physical movement assessments too. You're trying to see what's going on
Of course.
with just general function, with balance and all that stuff too. But then
Yeah.
when it comes to the eyes, let's just stick with something like concussion for now. And I know that you pick up a lot of stuff from the eyes, but what is there a moment in there where you're like, okay, there's something going on here that's a glitch, and does that cue you into what that next therapy is, and what does that look like for you? Is it something that you're going to treat oftentimes with your treatment, or are you then working in coordination with like one of your partners there or with another clinic?
Yeah, it depends. I mean, it depends on what the patient needs, really. If I think I can, help somebody, I'll always be honest with them and say, "Hey, here's what I think's going on. Here's what's happening, and here's what we can try and go for." If I don't think I'm a match, then I have no problem punting somebody out of the office and sending them somewhere else, right? So I'll
Yeah,
never leave a patient hanging and say, "I can't help you." Like, good
yeah,
luck.
yeah.
I don't believe in that, and I'm
Right.
grateful having a great network of people who are smarter than me and who do different things than me to be able to
Yeah.
send them out to. But usually, by the time somebody comes in, I have enough conviction because I'm usually doing a consult and talking to them about what's going on and kind of spending about 20 or 30 minutes before I even see them to say,
Yeah.
listen, like, what's your sleep like? What's your diet like? How motivated are you? Like, what's going on? What have you tried? What's worked? What hasn't? Like, I'm really keen on making sure that that happens because I don't want to waste someone's time. And
Yeah.
I get so frustrated when I can't help people. Like selfishly, like I
Yeah.
hate not being able to help
I
someone. And
know.
so if I can't do that, then I will send somebody out so they can get
Yeah.
help. Because I hope somebody would have the same mentality for me if I need to get put back together.
Yeah.
So
Yeah.
I'm really diligent with that. So by the time they're in the office, I have enough conviction to say, okay, this is at least worth an exam. This is at least worth my time and us digging into this. And then at that point, it's really kind of about saying how much conviction do I have about the tools and therapies that I have in the office.
Right.
So let's try something. Let's do, a couple days, a couple weeks of trial and error of therapy. Let's see what
Yeah.
works and what doesn't.
Yeah.
It's great to have the grand slams. You nail it right away and
Right.
everyone just takes off and it's awesome, but it's few far in between in my experience. And
Right.
I think that I'm continuously learning so much from my patients that
Yeah.
I'm just always gathering data. So it's an opportunity for me to hone in my skills and then hopefully help people, right? That's the whole goal and the whole focus of clinical practice, in my opinion. So
Yeah. And if they haven't had any success with somebody else, I mean, I run into this a lot where it's they've been down a lot of different, pathways to see if they can get something
yeah,
to resolve. And I have a fair amount of confidence in what I can do depending on the condition. So I might, suggest to them, could we try to do 4 sessions together, just so we have sort of like I want to have it be sort of a limited time, like if it's what I think it is, we can get this to resolve in this short period of time, or
yeah,
we'll see some change at this point, and if you want to continue beyond that, that's great. And then if I'm not getting what I think, then I know that I need to get somebody else involved.
hmm
That's
yeah,
often the case. Or sometimes I know right away, like, I also want you to have this person check you out, or go to this neurologist and have this thing checked out.
yeah.
So
I think setting expectations in the beginning is so huge, and I
yeah.
think that that's one of the things I wish I would have done right away in the beginning of
Oh, me
practice
too.
is
Me too.
realizing the importance of that. Because when you have that set of expectations and you have everybody on the same page and everyone knows exactly what's going to happen or what we should expect to see. And if we see that, great, like we're aligned. And then you have conviction on both sides of the story,
Yeah.
right? You have conviction for both parties, and that's huge. That buy-in is massive.
Yeah.
But if you don't set the table, and if you're like, oh, well, patients come in and sometimes humans are just good at forgetting where we start, right? And so like if you get to a specific point in time or a specific pain rating or a specific level of measurement and you're like, this is what we wanted in 2, 4, 6 weeks, whatever it's going to be. And like, yeah, we hit that. Like it's a good reminder for everybody to say, this is what we were expecting. This is what we wanted to see. Here's where we're at. I have seen so many patients, and I've made the mistake as well too, of like, over promising and under delivering at times, right?
Right.
Where you're like, okay, this is what I would see, or what we're going to see for this duration. Here's where I want you to get. And even though the patient got better, even though they had substantial relief, they weren't perfect, or they weren't
You wanted
exactly what I said it
100%.
was. And all of a sudden they're like, I thought I was supposed to be here. And I'm like,
Yeah.
yeah, shoot, like I thought you were going to be as well too. And I failed them on that front of the house
Yeah.
because I set them up for failure because it was unachievable or it was achievable, but just not in the duration of time that we were going after.
Yeah.
And so that's been a big learning curve for me to say, listen, I think I know. Let's try this out. Let's set expectations early on, right away. First conversation we have. So we're both on the same page. And then let's do this together, right?
Yeah.
I have to meet you where you're at. I've cared way more about patients' care plans than they have.
Yeah.
And that has, one, affected me personally, and I've taken that home with me for work. Like right when I got into practice, I wanted to help everybody, and I realized that some patients didn't want to help themselves as much as I wanted to, and
Right.
I hated that, and it hurt a lot.
It's a
So
partner. It's
meeting
a
people where
partnership.
they're at,
We have to expect that too.
yeah, and I knew that, but I didn't know it, right? Like one of
Right.
those
I
things,
know. I
right?
know.
And until you feel that emotion, it hits you. But meeting people where they're at too now is a big thing for me, and I think that just comes with experience, and there's a reason they call it practice, right? You're always
Yeah.
getting better and learning, and I'm sure you have, experienced some similar aspects of that as well
No,
too with the
so
work that
much,
you do.
so much of that, I think I've learned a little bit more to. I mean, I'm always kind of interested in a long term relationship with somebody.
Me
Like
too.
if I and not it doesn't mean they have to be coming back to see me all the time, but I if if I was helpful at a certain point, and I feel like, and you seem like this as well, I want to educate them well enough to know like what how they can use me.
Hmm.
That's the way I phrase it, because they may not have any idea what my skill set is at first, but
Yeah.
once they get a sense of that, it's like, okay, these are, once you know what all these things are, I'm going to let you direct this process a little bit
Hmm.
more. They might come in if I haven't seen them for a while, and they're like, oh, my hip's a little cranky, and I'm like, all right, we'll address that. What else is going on? How's your nervous system feeling?
Yeah.
How's work going? How's parenting going? All these things that, and if they're like, I'm over my head right now. I'm overwhelmed with everything. That directs the treatment. So then
Yeah.
I'll ask them, how do you feel about this kind of treatment? Eventually I'll say, what kind of work are you feeling like today? And they can direct it and tell me what they're in need of.
Yeah.
Right. And
Yeah.
and
It's huge.
sometimes sometimes it's more than just me. Sometimes I'm also working with somebody like you. And then I'm like, what are you and Erik working on right now?
Yeah. Yeah. It's interesting you actually bring that up because I think one of the best parts about treating patients, and one of the parts that I think modern medicine really is missing, is the relationship aspect, right? So
Yeah.
most medical doctors in a, private payer system only have like 10, 15 minutes max for a
Yeah.
patient, and then it's on to the next one.
Yeah.
And they're stuck in a system that I don't really think facilitates true healing and or the ability to practice true medicine because you miss that piece of the puzzle, which is that there's a
Yeah.
real human in front of you who has emotions and feelings, and the moment they feel as though that they're just another number, that nocebo effect is
Yeah.
massive for their health, for what they perceive as valuable, and then even just the conviction of belief, right? Like the
Yeah.
power of belief is very, very
Yeah.
real for
It
so many
is.
aspects. And I come back to the first point we talked about, which is the placebo effect.
Yeah.
It's genuinely the power of belief, right? And
Yeah.
so you can literally change concentrations of hormones, immunoglobulins, neural circuits in your brain by believing you took something that you
Yeah.
didn't. Like
Yeah.
that is a complete trip when you break it down to the fundamentals of how big of a impact that has on function.
Yeah.
And so that relationship piece is essential, and it always has been. I think we've just kind of gotten away from that, and I think
Yeah.
the doctors who are really practicing medicine and the ones who get it really realize the power of those relationships, much like you said, Jeremy.
Yeah.
And I think you are one of those individuals that I have so much respect for, is that your patients start off as a patient, but they all almost become like a mentee kind of mentorship relationship over time.
Yeah.
Is like they're going to ask you questions, and even if patients aren't seeing you, they know they can reach out to you. And
Yeah.
I've tried to do that for my patients as well. Patients know they can always email me.
Yeah.
Even if I did an exam on you 10 years ago, I'll still talk to you, still send you an email, still help
Yeah.
you. But the goal is to educate them to be able to take care of themselves. And when they need you, they can always reach out. But hopefully they're doing well enough to be able to, take things into their own
Yeah.
hands. And I think if we all focused on that, then the world would just be such a better place.
And if you think about the time element that you're talking about, I think on the front end of anyone's care, they kind of need the minutes, the
Hmm.
minutes and hours, right?
Yeah.
The time that I get, because I'm spending an hour and a half with somebody when I first meet them, usually sometimes 2 hours. Depends on what's going on with them, but that's the time at which they're gaining trust in me even more. Like that's a very important part of this. Like you're saying, that belief system has to kind of get set there, like, okay, I believe in this kind of that this therapy is going to have an impact, and I know how to work with this, right? I mean, they're also working with your therapy, so that's another part of it, and the other part of it is that we kind of, you and I at least, get to work within kind of a limited scope of patients. So, I think people only have a certain capacity daily to work with people and really be present to what's going on with them as a whole person.
Yeah.
And, if you're seeing, 40, 50 people in a day, it's just, I've worked with as many as, 8 in a day, 9 in a day. That's even starting to stretch what I can do. I can do it once in a while, but I try not to do that. I think for me, 6, 7 is sort of the sweet spot of like my threshold. And and I don't want to push past that. I could work more than I do, but that's my effectiveness, I think that level.
It's a bandwidth conversation as well too, right? So how much energy do you have to give? I mean, at the end of the day, when I'm seeing patients, sometimes I'm completely wiped emotionally, physically, mentally, spiritually. Like I try to give all of my attention and time to the person in the room that I'm with. I hate that some of the devices we use I have to have my phone out. Like I think it just changes the dynamic. And we know what even cell phones can do, like for relationships. If you're on your phone, you're talking to your spouse, or you're in a board meeting and there's a phone there, like we know that there's like actual neurological outcomes that occur with having a device like that around. And so I think we've moved a bit away from that. But the one thing that continues to give me faith in the system is the fact that people are starting to ask a lot of questions. I think COVID really brought out this paradigm of, what do we actually know? Just because somebody says something about this, or just because the government puts X, Y, and Z out, is that the truth? And what is the truth, right? Just because somebody says something, or just because the head of a department says something, it doesn't mean that that's the only opinion that matters. And so science is not a person. It is a process. It is it's a ability for us to continuously find the truth and challenge our thinking and narratives, and to be okay with realizing that something that we thought was true last year might be wrong today. That's beautiful, right? There's an amazing part of growth and feeling like a human with that, because you're continuously challenging that narrative. And so that's what's addicting to me. And I know I'll never know everything, but that won't stop me from trying to know everything, or as much as my brain can at least process until I get called upstairs, right? So there's a beautiful aspect to that, and I think
that's how you know you're in the right field too.
Yeah, I think, I think kudos to you with how many things you bring into your practice and all the things that you do. I mean, you are such a non-traditional body worker, and I think that trying to fit a square peg into a round hole is very difficult. I think that's why a lot of people find you and why they come to you, and they see you as a massive hub of information, is that you really are this, spoke in the wheel that really has such an amazing ability to, bring all this information together, to put it together in a different way, to make it something that we would call innovation, right? So that's what I love being able to do, is talk to people like yourself and the people that you work with, because I learn so much. It challenges my thinking, and I like that.
Likewise. I mean, that's how we came together in the first place. I heard you speak at one of the Minnesota Medical Holistic conferences a while back, and I was like, this is you're probably 30 at this point or something. I mean, it's like it's a while ago, and I was like, who's this guy? Total nerd. I love it. And we immediately connected and like met up, and it's like, okay, I get it. I understand the passion here. It's cool. And it just seemed like education. Like, you're a very good presenter. You really know how to piece together, an idea on something and see it to its endpoint, and also help people understand how it applies to, because we're dealing with other healthcare providers, how it applies to their field. So that's been really cool for me to see and see your growth and all of that too.
Well, I appreciate that. I do very much appreciate that, and likewise as well too. And I think the moment that I found out you and I are both musicians, and we're in bands and all that, is like, love it first, strum of the chord, and all of a sudden I'm like, okay, well now we have too much to talk about, so should probably back off a bit. But I think with that said, I think that there is something to be said about where we are versus where we're going. And when COVID was about, there was a great book that I read, and I'm trying to find it on my bookshelf right now, but it's something along the lines of, like, what got you here won't get you there, right?
Yeah.
So the same type of thinking, the same type of activities, the same habits that got you to wherever you are in your life, your career, your marriage, whatever, may not get you to where you want to go to the next level or the next phase. And I'm not saying you have to throw everything out that you've been using, but to challenge our thinking and our narratives and the way we process kind of information, you kind of have to, shed your identity and become a little bit of a different version of yourself. And so I think that continuous growth in medicine is something that you kind of have to have in medicine. Otherwise,
Yeah.
you will get left behind. You won't be able to help people. You won't be able to see that growth. And it's not easy work. Like, it is so much easier to think you know everything. It's so much
Yeah.
easier to say, oh, I only practice like I did when I was in the 90s, right? And like, there's people out there who still do that. But
Or to
unfortunately,
hyper specialize even, to do
yeah,
something that's within a very limited scope. Whereas,
yep,
you've chosen to like work with different kinds of diagnostics and, more, I don't know if it's bioelectric or just more electrical, devices and manual
yeah.
work and movement work. But sometimes it's like, what tool can I get there with the safest and see the quickest benefit from?
Yeah. And also, what are we not doing, right? So, one of my favorite books of all time is a book called Range by David Epstein.
Oh yeah.
And so, Range is just a phenomenal tale. For those who haven't never read it or heard of it, it's essentially, kind of challenging the narrative of, Earl Woods' parenting with Tiger Woods, and Tiger was just early stage specialization, early sports specialization from day one, arguably one of the greatest golfers of all time.
Hmm.
But Tiger had a lot of issues off the course and had a lot of things come to play where he didn't do as well as he could. But outside of that, it really talks about the comparison of him versus Roger Federer, multi-sport athlete growing up, was never pressured to play a specific sport, arguably became one of the greatest tennis players of all time. And he goes through in the book and talks about so many aspects of life and healthcare and innovation and creativity and comparisons of like Van Gogh and Tesla and all of these
Yeah.
brilliant
Yeah.
minds that we attribute to just amazing thinkers. And what they all had was this thing we call range, which is
Yeah.
a series of events that seem uncorrelated and like unconnected. But over time, as you acquire range and you acquire knowledge and experience, you're able to use an aspect in one area of a field and almost cross pollinate it with another to become
Yeah.
up with this thing that we call creativity and innovation.
Yeah.
And so, an example that he uses is like gel electrophoresis for DNA sequencing. So, the
Hmm.
inventor of DNA sequencing was a gentleman who saw his mother take care of his father's shirts, and he would use some sort of component of like, I think the substance was hard when it was dry, but it would become malleable when it was like a little bit more like higher temperature. And so he saw that and he was like, well, how would we like be able to use that in a mechanism to sequence out like genetics and like the weights of protein? Well, he would use electricity and he put this gel phoresis in and he came up with this because he was a tinker and he
Yeah.
was playing with a bunch of different things, but he had these early stage experiences shape his thinking to allow him to put that together.
Yeah.
And now this is just like a standardized version that we
Yeah.
use in all aspects of medicine. But he wasn't a brilliant man. He wasn't a genius. He was somebody who had range, who continuously challenged thinking, was always curious about things. And at some point, it came together to a point where he was able to bring an innovation to the real world.
Yeah.
And so I believe so many people have that and so many people can develop it. It's not that you're born with it. It's really a skill you can acquire and invest in.
Yeah.
But so many people are limited by seeing someone else do that and be like, there's no way I could do that. And so I think our biggest limitation is really the beliefs we put on ourselves.
Yeah. It's that thing of like, people say like a late bloomer or something. I think there's actually a TED Talk that's very related to range called something about, I'll put it on the show notes. It's something about being a multi-potentialite. And it was this woman talking about how, she kept going down certain roads to a point and then realizing that wasn't exactly where she was hoping to
Yeah.
get, and then shifting over into another place, and sort of each time she was finding new things, and eventually there was a convergence, which is, I feel like what you and I have kind of found in our work too, and that is the point, I think, of our own genius, whatever that is allowing those pieces to come together. I mean, even for me, even the fact that I was an English major and a musician who then ended up doing a health podcast, it all kind of, all those, I'm writing for it. I know audio, I'm doing all the different pieces that I just sort of knew I had no idea why this was something I needed to go down, but I was curious and I was willing to explore it. And also, I think that we're hitting a point where no one feels like they can have a hobby anymore. Like everything has to turn into, some money.
Yes.
And I feel like it's just, this is just a reminder for people to like be an experimenter. And this comes down to like a health thing too, is like, we're the kind of people that you can work with when you're trying to make some improvement, but you're kind of stuck in a place, and it's either going to be us or somebody we know who can say, oh, this is the information and the resource that you need, and here's the support that you need for that, and I can help you with this part, and so can help you with that. That's but you have to kind of be willing to experiment to a point where you hit a end point, especially like when I'm working with an athlete, and I know you work with some athletes too. I know that they're just trying to work on the boring stuff in some ways, right? The minutia that's going to get them just a little bit more over the top. And so I love that. That kind of a project for me is like, let's figure this out.
Yeah.
Right.
Well, and those are the fundamentals, right? Those are the
Right.
fundamentals. And, I think we have lost that kind of tinkering mentality, because I
Yeah.
think of like things that my dad and my grandfather used to do. They'd be in the garage and they're always just like doing things. And you'd ask and be like, "What are you doing?" And they're like, "I'm just tinkering. I'm just playing with stuff."
Yeah.
But that's where some of the best ideas come from, is this ability to kind of go out of your own space and not be so, goal oriented. But like that's where like brain circuits change, right? You kind of instigate these different modes and networks in the brain to allow you to have different nodes and hubs start talking to each other. I mean, this is kind
Yeah.
of what the latest data is showing for like plant medicine and like psychedelics, and what they're doing to the
Right.
brain is they allow the
Right.
brain to just, these super highways that used to connect each other are no longer just the only highways that connect each other. Now you have, think of all the county roads and all of the neighborhoods now interacting with each other, instead of just having it be the major highways in
Yeah.
Minneapolis, right?
Yeah.
Like
Yeah.
that changes the entire dynamic, but it also changes the output as well. And so there is something to be said about, using that. And you don't need, a psychedelic to do that. Like your brain already has,
Yeah.
its own internal pharmacy that produces hundreds and thousands of
Totally.
molecules.
Yeah.
And that's what's beautiful about like meditation and mindfulness and things like that. But
Yeah.
it's amazing to see where that stuff is moving, and it's just beautiful to see somebody who's in a state of flow, right? Like
Yeah.
that
Right.
flow state with tinkering and
Yeah.
challenging the mind. It's addicting, right?
Yeah.
And I love the research coming out about that, and how a lot of people are utilizing that to just solve problems, right?
Yeah.
Like an attorney may be able to solve one of the hardest problems in neuroscience. If they don't try
Right.
it, they're never going to get there. But
Yeah.
in Range, they had an example of a large pharmaceutical company putting out all of their biggest problems, and you got people from all over the world, from all these different professions, solving these problems that these high-level PhD researchers who were so narrow and so deep in an area had no idea how to solve. And
Yeah.
so it just challenges our thinking and reminds us that you think you know, but you really don't.
Yeah. Can you, speaking of this topic of tinkerers, can you talk a little bit about your little side project, trying to do some mentoring work and help fund some of these tinkerers?
Sure, yeah. So we founded Nobody Studios back in 2020, and Nobody Studios is essentially a venture studio. If you look at the startup space, if you look at like the metaphorical bankers of the startup space are, private equity, angel investors, venture capital, family offices, right? They
Mm-hmm.
always fund these projects. If you look at the mentors of the startup space, those are like the accelerators and the incubators. So think of it like
Yeah.
Y Combinator, Techstars, stuff like that.
Yeah.
A venture studio is essentially a co-founder with founders. So our goal is to, yes, bring in early stage capital. Our goal is to, yes, mentor early stage startups and help take them from 0 to 1. But most founders don't have the marketing, the branding, the tech stack, the leadership to actually take their company and go from 0 to 1.
Yeah.
A lot of them struggle. That's why you see a lot of them fail, things like that. And so we built Nobody Studios on the premise that technology is going to be changing very quickly. And with the advent of AI and large language models, we're already living in that stage, in that era.
Yeah.
We realized that a lot of companies were either being overfunded too early, and they were failing because they weren't being challenged and, maxing out credit cards to try and figure out a way to find a solution, right?
Yeah.
But then also, too, a lot of them weren't getting funding at all. And so there was no way for you to get off the ground. And so Nobody Studios, as a venture studio, is essentially a model and a platform for us to take ideas from the whiteboard and bring them to the real world. Our goal is to build profitable, valuable, scalable companies. Our focus for me specifically within the studio, as one of the co-founders, I lead our entire health and wellness vertical. And so
Okay.
if anything, dealing with whatever we've just talked about today on the meeting, but wearables, technology, software integration, truly finding ways to scale health and wellness, but also healthcare.
Yeah.
And so I selfishly get to listen to a patient's problem on Monday, ideate, innovate, potentially come up with a solution by Wednesday, build out an early stage MVP, find some tech, use AI, and have a viable product that is put together with duct tape and bubble gum and hand it to that person and say, here's a potential solution, help me break it.
Yeah.
Right. And so it's a model for me that, I never thought I would be somebody getting involved in startups and capital and all those things like that from my background.
Yeah. But it
But
feels
it's such a
similar
cool
to,
solution.
yeah, it feels similar to what I'm doing too, where it's just an inroad to meeting certain people who are like-minded or who are thinking outside of the box and building a community of those people that eventually start to solve some, bigger problems.
I selfishly get to hang with some of these smartest people in
I
the
know, me
world. I
too.
mean,
It's great.
PhD researchers. I mean, people who are worth millions. I've met billionaires with this too. And like, what amazes me is that these people are really no different than us, right? They've done some cool things. They've maybe figured things out, or they've worked so freaking hard to
Yeah.
get where they're at and made it look easy. And they've taken 10 years to become an overnight success.
Right.
But the one thing that it's instilled in me is that our life is full of chapters, and you never know what the next chapter is going to entail. If you'd have told me 5 years ago I'd be living overseas in London with my wife and building startups and all the things we did, I'd be like, you're crazy. Like, that's not on my roadmap.
Yeah.
Like, but if I would have gotten everything that I would have asked for in my journey and everything that I thought I wanted to be mapped out, I would have never gotten these amazing opportunities. And
Yeah.
so getting into the startup space for me is selfish from a standpoint that I think that some of the best companies have yet to be created. And I'm not convinced that the way we administer and provide healthcare right now is the best, most efficient way to do it. And selfishly, I want to be a part of a team of people who are brilliant and intelligent, who are challenging each other every day. And I want to help people help themselves.
Yeah.
And so for me, it's building the solutions that I wish that I would have had, or it's
Totally.
building the solutions that I wish my parents could have had, or my grandfather or my grandmother could have had.
Yeah.
And it's just finding a way to truly give people their health and having them own their health. And if I can have any part of that whatsoever, or have a ripple effect of helping somebody do that with their own company, even if I don't have any equity or any financial stake in it, to me is completely worth it.
Yeah, it's so cool.
And I'm learning so much in the process. So it's a humbling experience that is so hard to do, but it's addicting, and I love every minute of it. So, yeah.
So exciting, man. Well, thank
Yeah.
you. Thanks for digging in with me with all this stuff. Your remind me of the website for your Minneapolis practice. Is it?
Yeah, so the Neural Connection is our
The
clinic in
Neural Connection?
Edina. Yep, and
Okay.
so we are a specialized neuroorthopedic functional neurology clinic, and we really work with a lot of concussions, brain injuries, a lot of like migraine headaches, kind of things like that.
Yeah, yeah,
Dizziness, vertigo. I mean, you name it, we really work with it. It's a lot of just anything neurologically based. And our whole goal is to assess people structurally, neurologically, and metabolically to help people update their software.
gotcha.
That's the main focus on the clinical side.
Cool. I'll put a link on the show notes, and then we'll throw Nobody Studios up there too, just
Perfect.
in case there's somebody
Yeah.
that's
Perfect.
hears this.
We're always
and
looking
want-
for future nobodies, right?
Yeah,
So
yeah.
one of our investors, I'll never forget this. He goes, "Listen, I've spent my entire career trying to become a somebody, and here I am spending the rest of my career trying to become a nobody." So I always thought that resonated pretty efficiently with me. So
Nice.
yeah.
Well, look forward to seeing you again in person soon.
Yeah, I look forward to likewise too. And Jeremy, I can't thank you enough for having me on here. What you're doing and the amount of people you're helping, whether you've heard about it or not, is remarkable. And just, we need more conversations like this happening and more people challenging their thinking. And we need more great providers like you out there who are leading the charge. And so I applaud you for being a leader in this space. And
Oh, thanks.
I'm a big fan of yours as well. So
Thanks, man. Appreciate it.
of course.